Good day, viewers. A Quad Blog is reporting live at the Nigerian Institute of Medical Research right here in Yaba, Lagos for the May edition of the NIMR Media Chat. Today's discourse is focused on revealing the findings of the SAMAAN research project conducted by the Center for Reproduction and Population Healthcare Studies, spearheaded by Professor Oliver Ezechi. So stay tuned as the Quad Blog brings to you all the live coverage of the event as it unfolds. I am Daniel Samson Idowu, reporting for Echo Hot Blog. The Nigerian Institute of Medical Research is one of the shining lights in Nigerian health sector. It has become a trailblazer in public health research and advocacy in the past few months through its monthly conversation and the Rubbing Minds session with several media practitioners to bring to the purview of the public emerging health trends, factual analysis of social and public health concerns, and comprehensive presentation of quality health research findings. This monthly health advocacy and educative health crusade, termed NIMR Media Chat, was the brainchild of the Director General of the Nigerian Institute of Medical Research, Professor John Oladapo Obafunwa, who perceived the need to keep the public up to speed with vital health information and qualitative research findings carried out by the Institute in a bid to mitigate widespread health crises in the country through timely advocacy and public health education. The May edition of the NIMR Media Chat was another information-packed session as the Director General, Professor John Oladapo Obafunwa, led the executives into the boardroom for the discussion of the day, which centered on the presentation of the findings from the research conducted by the Center for Reproduction and Population Health Studies in NIMR, led by Professor Oliver Ezechi, and flanked by his team members Dr. Abidin Salako and Dr. Folaomi Akinsolu. The Center for Reproduction and Population Health Studies embarked on an infant mortality reduction research project in 2022 termed SAMAAN-1, Safety and Antimicrobial Resistance of Mass Administration of Azithromycin among children in Nigeria, in prompt response to a guideline issued by the World Health Organization in 2022, instructing countries with high infant mortality to adapt mass administration of azithromycin to children aged 1 to 11 months as an additional child survival strategy. Professor Oliver Ezechi gave a sneak peek into the scope and project covered by the Center for Reproduction and Population Health Studies under the Clinical Study Department in NIMR, detailing the positive strides made so far.
We have three main thrusts in what we do. First is health service to support research. Because when you are doing clinical research, you need also to have a clinical services provider for you to be able to next your research in that. And this area will provide care to people living with HIV/AIDS. We also provide prevention of mother-to-child transmission, and which will tell you in the institute, we started in 2004 when we started prevention of mother-to-child transmission. And in the last 4 years, no single mother who passed through the clinic have had a baby that is HIV positive. So in this institute, we've shown that it's possible to achieve zero to mother transmission facility, showing that the most important is the drug, ensuring that every HIV positive mother swallows that drug. We also provide cumulative, we provide HIV care to over 25,000 patients since we started in 2004, and we'll continue to do that. We also provide some cervical cancer screening services at the clinic there, which also supports our research in the area of cervical cancer, and we also impact on HPV vaccination. Because of the hesitancy we had during Nigerian rollouts, we also have research, what we call mother-daughter dyad. The essence is that to promote cervical cancer screening by offering the mother cervical cancer screening and offering, if they have a child that between 9 to 13 years of age, to also try to educate them on the importance of vaccinating their daughter. We also have a capacity building effort for research, because as we are getting old, we will soon retire. We also need to bring up new, younger people to also to embrace research. We have 2 programs to enhance research capacity of younger person. The one is what we call NIMR Nigerian Research Training Program, where we train young faculties and young researchers to learn how the rudiments of responsible conduct of research, how to write grants writing, because you need funds to do your research work, and also how to do ethical research. That we are doing in collaboration with Emory University in the United States, University of Lagos, and EPIN Public Health Initiative. We also have another one we call the Cancer Control Center for Research on Implementation Science. Like the DG said, when you are talking about clinical sciences, as you are doing your research, you're also providing services. So we are teaching young faculties on how to do that simultaneously. As you are providing services, you're also conducting research. The SAMAAN project, we are going to talk in detail later, embodies that. We are providing service to children, we are at the same time conducting research. And finally, the third aspect of what we do is research for national health. And we have a number of projects, research projects that borders on cervical cancer, borders on hepatitis, borders on non-communicable diseases among HIV positive.
Then, Professor Ezechi dived into the thick of the discussion as he introduced the topic of the day, SAMAAN 1 research project, stating its aim and objectives and the processes involved, while drawing inferences on the mitigating factors and challenges encountered during the course of the research.
SAMAAN project is called the Safety and Antimicrobial Resistance of Mass Administration of azithromycin in children. So we selected 6 states in the country, 3 in the high infant mortality endemic states in the north. The state that was selected is Akwa Ibom, Ikono local government in Akwa Ibom, in Abia State, Umunochi local government, in Kebbi State, Kano State, that's Wamako, and then in Sokoto, Wamako is Kora local government. So these are, we implemented fully in Kano and Jigawa, the entire state. But in Kano was Kora, and Sokoto was Wamako local government. While in Abia State, we implemented in Umunochi local government, and in Akwa Ibom, in Ikono local government. With other partners, this is a partner ensuring that every key player in Nigerian health system space is involved. NAFDAC was involved, National Primary Care was involved, other development partners like Site Savers were also involved, and then all the states in where we are, but NIMR was leading the research components. We implemented that for 2 years, every 6 months. First of all, we conducted a baseline studies to collect the data, the baseline infant mortality in those places. And then every 6 months, we dose these children with mass azithromycin. After that 2 years, our results were positive, and based on that and some of the other results emerging from Niger, Mali, they have a study where similar studies also being done. Instead of restricting the drug to 1 month to 11 months, we decided to expand the drug dosing to 1 to 59 months of age.
Also, Professor Ezechi revealed the remarkable findings and statistical facts and figures that largely indicated the successful implementation of the research objectives, which led to a positive outcome and inspired the team to embark on another SAMAAN project tagged SAMAAN 2.
We also realized that this intervention is more effective in states or areas where the infant mortality and morbidity is high. So what it means is that it's more cost effective to go to where the deaths are high. And that's why we decided in SAMAAN 2 to focus on 11 high infant mortality endemic states in the north. And these states are same Kano, Kaduna, Katsina, Sokoto, Kebbi, Jigawa, Borno, Bauchi, Zamfara. So these are the 11 high endemic infant mortality states that will be focusing on there. The essence is that while we are doing research, we're ensuring that any eligible child in that environment swallows the drug. And exactly the same thing we did in SAMAAN 1. That's where the clinical research is completely different from other research. In Kano, we are going to conduct a study using a method called step-weighted, in which every child will get the drug, but we introduce local government by, one after the other, one after the other. While you are starting with some local government, the other ones acting as control. But in 3 months' time, every child keep getting that. That's what we are adopted in this. We're ongoing now in Kano, Kaduna, Bauchi, and Katsina. We've conducted a baseline assessment and also collecting data for AMR in these 4 states. We are going to move to the other states. These are community-based people who are not doing research before, but we have to train them to be able to collect because of the enormous number of persons. The other journalists will also have opportunity to go to other states to also witness first-hand information of what we are doing in the field.
Also, Dr. Abide Nsalako and Dr. Folahanmi chipped in some important factors that contributed to the success of the SAMAAN 1 research project, while also pointing out some limitations and challenges.
But most importantly, we are also able to establish that the drug is safe in SAMAAN 1. And that has opened up opportunity for SAMAAN 2, and which we are pushing up beyond 1 to 11 months to 1 to 59 months. Antimicrobial resistance, it's a canker worm everybody wants to curtail. This gives NIMR the position, not just as a research institute to speak, but again to contribute to science beyond the Nigerian space, but in the global space. We can boldly say that we've been able to distribute 1.8 million doses in SAMAAN 1, in those 6 states we are in, across 52 local governments, and a total of, and then we are expanding. Kaduna, as we are speaking now, Kaduna and Kebbi, they are rolling out 100% to every local government, every child 1 to 59 months, except if the child doesn't meet the criteria. And we are not just giving it and forcing it down their throat. They are now becoming the advocate of improved health. This is how you want us to do it. This is how we should do it. And I think these are successful stories that if we build on and if we latch on, then NIMR really can continue to hold the space as the Nigerian Institute of Medical Research and the foremost institute in research conduct in the country. Thank you, sir.
Most policymakers and stakeholders, they don't understand the critical role research actually plays in driving sustainable development. And if you listen carefully, in SAMAAN 1, there were some states that were supposed to go, but they refused. So you can imagine we've been able to identify that there's a high prevalence of this particular situation in your state, and we would like to come and implement, and you said no. So that's one thing that we've been seeing. And it's not only in that state, even though that state's rejected outrightly, there's some states that before we can even start implementation, it's a big challenge. We have to face a lot of rigor. In SAMAAN 1, we had to go and do re-advocacy like 6 times. So like you're going back to the same group of people 6 times to tell them that this is what we want to do and this is why it is important for us to work around it. Then another challenge that we have is the inadequate laboratory structure. So you can imagine we're trying to bring all samples from the northern part of Nigeria down to Lagos to analyze in NIMR. Do you know what that is? It's a lot of money. But if we have those laboratories over there functional, working properly, there's no need for us to transport those samples all the way from the northern part down to Lagos to analyze and then tell them that this is the result we have. So I think most of those labs are not well equipped, and I think it's a major challenge that is also constraining and affecting our logistics here in the implementation of the SAMAAN project. Then the northern part, I'm quite sure some of us know how it looks like. The terrain, there's some areas they will tell you not to go. There's some local governments you want to implement in all local governments, and they'll tell this particular local government, this particular one, it's no-go area. Last year, some of the research assistants were attacked in some local governments, and this were some of the things that we face. So sometimes when we say that, oh, it's a good thing, there is this part of it that is bad, and there is this part of it that is actually very ugly. Then another thing else I think we should also look into is the shortage of skilled human resources, and that's why we have to do training. Sometimes we have to do retraining. Even while they're on the field, we have to follow up with the research assistant to ensure that they're doing the right thing. So we don't really have much skilled people, and that's why sometimes we have to bring people from NIMR to go over to those states to actually see what is going on. Because if we are not there, whatever they will send to us is whatever we're going to receive. And at that point, all our resources at that point are what? Are wasted. So that's the reason why sometimes we have to be there to see what they are doing day by day, to monitor at the back end that the data are coming in, they're collecting the samples the way they're supposed to collect them. Because if we don't monitor them, we just find out that whatever they're collecting is what we're just going to work with, and that will not give us what we hope to get at the end of the day. Then I would say that logistics, culture, and sustainability constraints is also one major thing. So the logistics of travels, we've moved in a particular place in Kano for 2 hours and we couldn't see anybody. We're in the Marua, but we needed to go to that particular place, had to reach area. So these are some of the things that we face on the field, and these are some of the challenges that we're looking into in such a way that reaching this underserved population is actually a big thing. But the question is, do we have to? Yes, we have to, because that is the main aim of the project.
In addition, Dr. Ezechi digressed further by discussing child mortality at the point of delivery while revealing several ignorance-induced factors as well as quackery as a leading cause of maternal mortality rates in the country.
One of the things to do if you want to start addressing issue of maternal mortality and infant mortality, and that's what the role of NIMR should be, is for private sector and the government to support NIMR to do a national maternal mortality and infant mortality audit. Any sudden unexpected death shall qualify for an autopsy. So, and most maternal deaths are sudden and unexpected. So it's already even in our law. When we are doing residency, that was during Olikoye's time. Every maternal death in Nigerian hospital must be reported. I still remember those days in Ife. And because of, you have to come and report. If a woman dies under your watch, whether the woman was just brought in and he just gave up, you must come and explain why that woman should die.
Then, NIMR Director General, Professor John Oladapo Obafunwa, also elaborated the discussion by revealing a blind spot point on maternal mortality causes and effect on stillbirth and maternal casualties.
Yes, it said that Nigeria has a very high maternal death rate. Now I believe that, but the question is this: do we really have the statistics? And we know that you can always use statistics to achieve whatever results. It depends on how you try to interpret it. Is it also possible that part of the problem has to do with the population of Nigeria giving a bloated viewpoint? I'm just asking a question. I'm not making a statement. How do you get the statistics? One sure way of getting the statistics is by ensuring that you have a proper coroner system and you perform postmortem examination. Somebody even mentioned the fact that there could also be the problem of access to the hospital. How many of our women die in the course of trying to go to hospitals? You've talked about the issue of quackery. I just felt I should throw all these things on the table for us to look at. Unfortunately, that aspect of investigating maternal mortality cannot be executed by NIMR. It has to be a national thing. And I wish us luck.
Yeah, thank you.
Following the conclusion of the discussion of the day, media practitioners asked decisive questions bordering on the ethical implications of the mass-scale administration of azithromycin on children, including inquiring about the appropriate dosage of azithromycin, while some other further questioned the prevalence of mother-to-child HIV transmission and its potential contribution to maternal mortality. Professor Ezechi provided in-depth answers to the questions based on his wealth of experience in that regard, backed up by logical conclusions.
A lot of Nigerians who think research is bring money, let's share. And you are trying to tell them that this is to make sure that our children stop dying. And they are telling you, we are not interested. What we get is the what that is still, and generally people don't see research as a critical tool in national development. So that's also still a major challenge. So to summarize what we've done, we've typically seen a typical clinical science and public health research where you are ensuring that every child in that community, now with those almost more than 4 million children have received the drug, while at the same time we are also conducting research. Where we are conducting research, we are also mindful of that you don't undermine people, you don't expose persons to unnecessary risk, so that at the end of the day, it will be a win-win situation.
The May edition of NIMR Media Chat was an eye-opening session indicating the giant strides that NIMR is making in measuring up to global standards through swift and decisive approach to health research and advocacy, particularly in clinical health research, as seen in the SAMAAN research project. For Echo Heartblog, this is Daniel Samson Idowu. Indeed, it has been a moment of critical reflection and evaluation of the findings from the SAMAAN research project conducted by the Center for Reproduction and Population Healthcare Studies right here at NIMR on the occasion of the May edition of the NIMR Media Chat. Thank you for staying tuned. Do not forget to follow us on all our social media platforms on X, Instagram and Facebook at Echo Hotblog. Also subscribe to our YouTube channel at Echo Hotblog. I am Daniel Samson Idowu, reporting for Echo Hotblog.